there, it's the AEP for Medicare Advantage and Medicare Part D. So let's take a look at those 2024 plans. But before we do, please make sure to subscribe to stay up to date, and of course click that like button so that we can get this information out there. Now if you have any questions, you can reach us at the number on the screen or in the comments below. And just so you know, subscribing, liking, leaving a comment with your question or your feedback will help to get this video out there to others who are looking for the same type of information and help us to grow our channel. So we thank you in advance. As a reminder, the Medicare AEP for Medicare Advantage, which is Part C, and Medicare Part D, which are prescription drug plans, is every year from October 15th to December 7th. So make sure to enroll during that time. Now let's start with Medicare Advantage. Medicare Advantage plans are also known as Part C plans, and they're actually a replacement for Original Medicare. So no, you can't have Original Medicare and Medicare Advantage together. Medicare Advantage plans will operate similarly to insurance that you've had in the past. So there are HMOs and PPOs to choose from, and you will have to operate within network on an HMO. You can operate outside of your network on a PPO, but of course that's going to be more expensive. Bear in mind that these are managed care plans. That means that you may need pre-authorization for certain services or treatments, and if you have an HMO, you will need a referral from your PCP, which is your primary care physician, to see a specialist. Now, the good thing about Medicare Advantage plans is that not only must they offer at least the same benefits as Original Medicare, but very often they offer additional benefits as well. Things like dental, vision, hearing, and prescription drug coverage, and a lot more. And very often, they will offer you these types of plans with no additional charge. You'll just need to continue to pay for Medicare Part B. That being said, please be aware of those networks. They can be restrictive, and of course, that pre-authorization issue. These are two of the major downsides of Medicare Advantage, and you should be aware of that before making the switch from Original Medicare to Medicare Advantage. Now let's take a look at the plans. Okay, so we start on this page and it's going to ask you to put in your zip code. I'm going to put in an Arizona zip code. Then we're going to start out by looking at Medicare Advantage plans, also known as Medicare Part C. Here it's going to ask you if you get any help with your costs, specifically from these programs. Medicaid, which would make you eligible for a D-SNP because those are dual eligibility special needs plans. Supplemental security income, a Medicare savings program, extra help from Social Security. You can also put I'm not sure, which will show you these options, or I don't get help from any of these programs, which is what I'm going to select. Now it's going to ask you if you'd like to add your prescription drugs. I already put some prescription drugs in, so I actually left Synthroid as a name brand non-generic. That way you can compare those costs in addition to a generic. Done adding drugs. It's going to show you pharmacies. It's going to allow you to pick up to 5 pharmacies. Now, I recommend that you select at least one mail order option. That way you can compare those costs. I've selected Walgreens, something called Four Corners, CVS, and I also selected a Walmart. That way we can compare those costs as well. Now here are the plans. It's showing me 10 of the 64 plans available based on the information that I've put in so far. Right now it's sorting the plans based on your total known yearly costs. Now, of course, that doesn't include any copays or coinsurance because you don't know if you're going to need to utilize those services. So it's just taking into consideration your total yearly premium costs and your total yearly drug costs based on the information that we've put in so far. So this is the first plan that it offers, which is an HMO with a $0 monthly premium. Now, just because it says $0 here doesn't mean that's all that you pay, because you will still need to pay at least your Part B premium. It's also going to show you your total drug and premium cost for the year. So this is the estimate for your total yearly costs based on the information that I put in. Here it's showing that there are 2 separate deductibles. So there's a $0 health deductible if you need to see a doctor, a specialist, visit a hospital. And then there's a separate drug deductible, which is $185. It's also showing your out-of-pocket maximum, which is $4,550. Now you'll see here that it says in-network. That's because this is an HMO, which will only provide benefits in network, except in the case of a true medical emergency. So unless it's a true medical emergency, if you choose to go out of network on an HMO, that means you will be responsible for the full bill. Over here, it's going to detail the plan benefits. It's just really a quick snapshot. So the check marks mean it's included, the X's mean it's not. Vision, dental, hearing, transportation benefits, fitness benefits, worldwide emergency, and telehealth, which is certainly very handy. It will also offer you benefits for over-the-counter drugs. So you may get a certain amount free per month. You may get a discount on them. It'll also offer you in-home support, no home safety devices, and it'll offer you emergency response devices. Your copays are listed over here, $0 for a primary, $0 for a specialist, and then of course it includes drug coverage. Now we can compare several plans, so I'm going to go ahead and compare this plan here. And when we do that, we'll be able to see the plan details in further depth. Now if you scroll up, let's say that you definitely wanted a PPO because you want more flexibility. Just click there and click apply. It's now going to show us the PPOs. So there are 27 PPOs available based on the information that we've put in so far, and it's showing me the first 10. Again, it's sorting by lowest drug and premium cost. So here we have another plan. This one again has a $0 monthly premium. The estimate for your yearly costs is $480 for your premium plus your prescription drug costs based on what we've put in. There's a $0 health deductible, a $0 drug deductible, and 2 different out-of-pocket maximums because with a PPO, you have coverage in and out-of-network. Now, in-network doctors will be less expensive than out-of-network doctors, but it still gives you some type of coverage. So it's a $6,500 total in and out-of-network, out-of-pocket max, or a $3,900 strictly in-network maximum. We're going to add to compare here. Now, I'd like to go back up once more. Here you will see that you can filter based on insurance carrier. And for a Medicare Advantage plan, that is very, very important. So Medicare supplement plans, which are not Medicare Advantage plans, are also offered by private carriers. However, if your doctor accepts original Medicare, they accept your supplement plan regardless of who the carrier is. That is absolutely not the case with Medicare Advantage. So if you already have doctors and specialists that you like to use, or a hospital that is convenient and you feel comfortable with, and you know what plans they accept, then you definitely want to make sure that the plan that you choose works with those hospitals and specialists and PCPs. So let's say you know that you have a doctor who accepts Humana amongst others, but Humana is one of the few plans that they accept. So you click Humana, you click apply. And now we will see just the Humana plans available. So here there's 11 Humana plans available, and again, it's showing me 10. So again, this plan has a $0 monthly premium, not including that Part B, and your estimate for your yearly costs are $511.92. The drug deductible is $0, the health deductible is $0, and you have 2 separate out-of-pocket maximums for in and out-of-network versus just in-network. If you look over here at the benefits, you will see that vision, dental, and hearing are covered, no transportation, fitness, worldwide emergency, and telehealth. You will get some support for over-the-counter drugs, but none for in-home support, home safety devices, or emergency response devices. Your PCP is a $0 copay, a specialist is $35. Now, we could add this plan to compare, but let's take a look at some other things that you may want to include. So here are some of the more commonly requested benefits: vision, dental, hearing, transportation, and fitness benefits. Let's say it's very, very important to you that your dental is covered. Well, let's click that and apply. It's still showing 10 of 11, so I guess they all cover dental. So let's add something a little bit more specific. Let's add transportation. And now there's only 3. Now, that being said, I certainly wouldn't recommend or give a blanket recommendation that you should make a choice of something as important as your health insurance based on a fringe benefit like transportation, but it can at least help you to narrow down the field. That being said, if there is a much better plan that offers you a broader network and better costs on your prescription drugs, and it maybe doesn't have vision or dental, those are always the types of benefits that you can get a separate plan for. So it's really much more important that you make a decision based on your main benefits as opposed to the fringe benefits, so to speak. But let's use this plan to compare. So I'm going to add that one to compare. And here we are. So let's scroll down. We're going to compare your health deductible, $0 across the board. This one plan, which is the HMO, has $185 drug deductible. The others do not. You can compare your out-of-pocket maximums, your premiums that you would pay, your drug premium that you would pay, your Part B premium, which is going to remain the same, the snapshot of those benefits that I mentioned, although it does go a little bit further into detail, you'll notice. So not only does it offer worldwide emergency over-the-counter drug benefits, in-home support, it also offers chiropractic services. It doesn't offer home and bathroom safety devices or meals for a short duration, but it offers endodontics, periodontics, extractions, and if we click here, it'll show us more benefits. So that gives you a better idea of the benefits offered. This plan actually does offer meals for a short duration. Now, if you wanted to see the additional benefits, click here where it says View Additional Benefits, and here you go. This is going to give you a better idea of what your costs might be for dental. This is very important because it says limits may apply. There may be limits on how much the plan will provide. So that could be a financial limit. It could be the amount of times per year. Something very important, especially when we're talking about dental, is if you choose an HMO plan, well then bear in mind that you're going to have to go in-network for your dental services as well. Scroll back down. Here you can compare the costs for a primary care doctor, a specialist visit, diagnostic tests and procedures. So $0 copay, $5 or $40 if it's out of network. I did mention that out of network you will still have coverage, but it will be more expensive. If you were to go out of network on an HMO, then you would be responsible for the full cost. You can compare the rest of these services. $120 copay per visit, $85, $120. Urgent care, 0 to 25, $20, $40. Inpatient care, very important. So this is $225 per day for days 1 through 6, but then $0 for days 7 through 90. This is $150 for day 1 through 3, and then $0 for days 4 through 90, or 30% if it's an out-of-network and it's not a true medical emergency. Outpatient care, preventative services are going to be $0. You can see that this does offer coverage for hearing aids, although you can now get hearing aids over the counter, I would like to mention. It's not covered by this plan. Dental services, eyeglasses, wellness programs, transportation, $0 copay, not covered. This one's only covered in-network. Skilled nursing facility care. Let's continue to scroll down, and here we can look at the drugs that I entered and those pharmacies, because this is important. You'll see that we have most of these pharmacies are in network, and you can compare the costs. Now, the only exception is the Four Corners Pharmacy isn't covered by 2 of the 3 plans, but it is covered by the 3rd one. Let's take a look at the costs. So here we have Walgreens, $40.40, CVS and Walmart, $38.64. And here's an unusual one. The mail order pharmacy is actually more expensive. That's unusual. In the second plan, it would be $480 for Walgreens, CVS, or Walmart, and the mail order is the same. And then here with this 3rd plan, this would be our most expensive option. Walgreens is $939.72. CVS is $945.12. It's the same for Walmart. This Four Corners Pharmacy is also covered, $931.92. And the mail order pharmacy is $796, so significantly less expensive. You will notice that if you put in a different zip code, that you get different plans and different prices. We're just answering the same questions that we answered before. Let's put in the same drugs. That way we compare that as well. Synthroid, at drug, keep brand. We're going to add the exact same ones that we added before. Here's our generic. All right, that's enough. Done adding drugs. We're again going to select 5 different pharmacies. We don't need 2 Walgreens. And let's pick a Walmart. Done. Here are the HMOs. Now, already off the bat, we can see that having put in a Florida zip code, we have a $0 health and drug deductible. $0 estimated for the yearly costs. $2,000 out-of-pocket maximum. with a lot of benefits covered, $0, $0. Now, why are we already seeing that the plans here might be a little bit less expensive? That's because I put in a Florida zip code, and just something to take into consideration, Medicare Advantage plans are much more popular in Florida than anywhere else in the country. I could also go over here and put a PPO, and you'll still see that mostly we're looking at lower costs. And again, that's just because Medicare Advantage plans are much more popular in Florida than anywhere else. I'm not going to take you through comparing all of these. I just wanted to give you an idea that if you put in different zip codes, you're going to see different plans and different prices. Now let's give you a brief introduction to Part D, which are your prescription drug plans. As a reminder, Original Medicare does not offer prescription drug coverage, except in very limited instances. Things like chemotherapy or injections administered at a doctor's office, or insulin if it's administered via pump. And there's a list that actually details what prescription drugs are covered by Part B, and I will put that in the description below. But most of those prescriptions that you take on a regular basis, a daily basis, will not be covered by Part B. And that's why you would need a Part D plan. So in addition to that premium that you have to pay, there are different financial stages of Medicare Part D. The 4 stages of Medicare are financial thresholds or caps that change on a yearly basis. So in 2024, the deductible is $545. Of course, it can be less based on your plan. This is just the maximum deductible that any plan can charge, and that's up from $505 in 2023. At that point, you would enter into the initial coverage phase. Now, some prescriptions, those Tier 1 and Tier 2, will be covered prior to meeting your deductible, but the higher tier medications will not be until you meet the initial coverage phase. At that point, you'll be responsible for a copay, which is determined by the tier of the medication. There are, of course, 5 tiers. As you continue to spend, and you reach $5,030, which is up from $4,660, you would enter into the coverage gap or donut hole, at which point your copays would increase. And should you continue to spend up to $8,000, you would enter into the catastrophic coverage phase, at which point your copays or coinsurance would drastically decrease. Now let's take a look at the plans. We are back again on Medicare.gov. This time let's put in a North Carolina zip code. And we're going to look strictly for Medicare drug plans, which are Part D plans. It's asking the same questions it asked us before. Do you get help with your costs from any of these programs? We're going to put I don't get help. Let's put in the same prescription drugs that we put before. You'll add that, keep the brand, and let's add another drug. This time we will do the generic that we did before. Also, it's important to remember to select the correct dosage. We are done adding drugs. Again, we're going to select pharmacies. We'll pick a mail order, Walgreens, Harris Teeter. What else can we pick? Let's do CVS. And let's pick something a little less popular. We'll try that one as well. Done. All right, so here are the 21 plans available to us. Again, it's sorting by lowest drug and premium cost. Now you could, if you wanted to, just sort by lowest premium. And here you go. There's actually a plan that's $0 per month, and we are seeing this with the WellCare plans. However, based on Medicare.gov's calculations, we would better be served going with a different plan based on our estimated yearly costs. So let's take a look. We have the Silver Script plan, which has a $5.20 monthly premium. And here are our estimated costs at a retail pharmacy and a mail order pharmacy with this plan. It looks like it's going to be the same, $468.48. And the deductible is $280. So let's add this plan to compare. Now let's go back up. And this time, let's sort just by lowest monthly premium. So again, this is taking us back to that WellCare plan. We're going to add that one to compare. And I'd also like to take a look at the lowest drug deductible. This one has a $0 deductible. So let's add that plan to compare. So here are the 3 plans that we chose. We have a $5.20 monthly premium, a $0 monthly premium, and a $78.90 monthly premium. There is, generally speaking, a very strong relationship between premium and deductible. Usually the higher the premium, the lower the deductible. And we see that here as well. We have a $0 monthly premium and a much higher deductible. And now we'll just compare the pharmacies and costs. Scrolling down, you can see that all of these pharmacies are covered except for Walgreens, and for the other plans, they're all covered. And here's an estimate of our costs. So let's take a look. We see that CVS would be $470, Walgreens out of network, so we don't want to do that, $468, $473, and $468. So all pretty comparable. Here we have $542, $550, $550, $528, and the lowest cost for this one is the mail order pharmacy, $496. Coincidentally, this is also the lowest cost, but it's tied with Harris Teeter. And then on this much more expensive plan, we have much more expensive copays. So looking at these alone, it's pretty clear that this would not be the plan for you based on that information. You can also click here where it says Plan Details. And if you scroll down in here, it'll break down your yearly drug costs by pharmacy. So it's possible that in one pharmacy, one prescription might be less expensive than the other. Now, our generic is $0 or $480. So it's $0 at CVS, $0 at Harris Teeter, $480 at Hawthorne Drugs, and it's $0 at the mail-in pharmacy. Now, that being said, take a look here. Even though the generic is $0 here, the name brand is $408. This is your yearly cost, of course, and it's $406 at Hawthorne. So let's be real, it's only a $2 difference, but it could be a more significant difference. So going on this alone, it would be better for you to get your generic filled at CVS or Harris Teeter or the mail order pharmacy and have your Synthroid filled at Hawthorne Drugs. Again, it's only a $2 difference, but it could be much more significant, in which case it would be helpful to know this. And then down here, it will break it up even further based on the month. Now, if you're seeing here that all of a sudden your costs are dropping from $44 to $29, that's because you've met your deductible. So at that point, the Synthroid, which is your name brand, would be a lower copay instead. And that's why all of a sudden we're seeing $29, $22 instead of that higher $44. If you were to continue to spend, which won't happen based on this case example, eventually you would hit the donut hole or coverage gap and you would see those costs jump back up. So that's pretty much it for 2024. Remember that the AEP runs from October 15th to December 7th, so don't miss out on this enrollment window. Now, if you have any questions whatsoever about Medicare Advantage, Part D, Medicare in general, you can reach us at the number on the screen or in the comments below. There's absolutely no charge for our services, and we are licensed nationwide, so we are more than happy to help. But before you go, make sure to subscribe to stay up to date, and please like this video so that we can get this information out there. As always, thank you so much for watching and have a wonderful day. Bye-bye.